Good morning, guys. I'm going to be recording some highlights that you will need to make sure you highlighted through chapter 4, 5, and 6. Again, it is your responsibility to read the entire part of the chapters, not just only pay attention to what I'm going over. So we'll get started. On page 87, chapter 4, vital signs. Vital signs are objective guideposts that provide data to determine a person's state of health. That needs to be highlighted. Vital signs include temperature, pulse, and respiration, and blood pressure. Another indicator of a patient's health status is a pulse oximetry. All of that needs to be highlighted. Although some providers order this measurement routinely for all patients as part of the patient workup, most providers order measurement of this vital sign only when the patient complains of respiratory problems, for example, shortness of breath. The normal ranges of the vital sign are finely adjusted, and any deviation from the normal may indicate disease. During the course of an illness, variations in the vital signs may occur. The medical assistant should be alert to any significant changes and report them to the provider because they can indicate a change in the patient's condition. When patients visit the medical office, vital signs are routinely checked to establish each patient's usual state of health and to establish a baseline measurement against which future measurements can be compared. The medical assistant should have a thorough knowledge of the vital signs and should attain proficiency in taking them to ensure accurate findings. Please highlight the following. General guidelines that the medical assistant should follow when measuring the vital signs are as follows. Number 1, be familiar with the normal ranges for all vital signs. Keep in mind that normal ranges vary based on different age groups, for example, infant, child, adult, and elder. Number 2, make sure that all equipment for measuring vital signs is in proper working condition to ensure accurate findings. Number 3, eliminate or minimize factors that affect the vital signs such as exercise, food and beverage consumption, smoking, and emotional state. Number 4, use an organized approach when measuring the vital signs. If all the vital signs are ordered, they are usually measured starting with temperature, followed by pulse, respiration, blood pressure, and pulse oximetry. Temperature. Body temperature is maintained within a fairly constant range by the hypothalamus, which is located in the brain. The hypothalamus functions as the body's thermostat. That needs to be highlighted. It normally allows the body temperature to vary by only 1 to 2 degrees Fahrenheit throughout the day. Body temperature is maintained through a balance of the heat produced in the body and the heat lost from the body. A constant temperature range must be attained for the body to function properly. When minor changes in the temperature of the body occur, the hypothalamus senses this and makes adjustment as necessary to ensure that the body temperature stays within a normal and safe range. If an individual is playing tennis on a hot day, the body's heat cooling mechanism is activated to remove excess heat from the body through perspiration. Heat production. Most of the heat produced in the body is through voluntary and involuntary muscle contractions. That needs to be highlighted. Voluntary muscle contractions involve the muscles over which a person has control, for example, the moving of legs and arms. Involuntary muscle contractions involve the muscles over which a person has no control. Examples are psychologic processes such as digestion, the beating of the heart, and shivering. Body heat is also produced by cell metabolism. Heat is produced when nutrients are broken down in the cells. Fever and strong emotional states also can increase heat production in the body. Heat loss. Heat is lost from the body through the urine, feces, and water vapor during exhalation. Perspiration also contributes to heat loss. Perspiration is the excretion of moisture through the pores of the skin. When the moisture evaporates, heat is released and the body is cooled. Radiation, conduction, and convection are all cause loss of heat from the body. Radiation is a transfer of heat in forms of waves. Body heat is continually radiating into cooler surroundings. Conduction is the transfer from heat from one object to another by direct contact. That needs to be highlighted. Heat can be transferred by conduction from the body to a cooler object it touches. Convection is the transfer of heat through air currents. Cool air currents can cause the body to lose heat. That also needs to be highlighted. Body temperature range. The purpose of measuring body temperature are to establish the patient's baseline temperature and to monitor an abnormal high or low body temperature. The normal body temperature range is 97 degrees Fahrenheit to 99 degrees Fahrenheit. That needs to be highlighted. The average temperature being 98.6 degrees Fahrenheit. Body temperature is usually documented using the Fahrenheit system of measurement. Lists comparable Fahrenheit and Celsius temperatures and explains how to convert the temperatures from one scale to another. So if you guys will look onto the very next part of that, page 89, table 4.1, that kind of gives you a way to measure whether you're doing Fahrenheit or Celsius temperatures. Alternations in body temperature. A body temperature greater than 100.4 degrees Fahrenheit indicates a fever or pyrexia. If the temperature falls between 99 to 100.4, this is called a low-grade fever. That needs to be highlighted. When an individual has a fever, the heat the body is producing is greater than the heat of the body is losing. The temperature reading greater than 105.8 degrees is known as hyperpyrexia. Hyperpyrexia is a serious condition, and a temperature greater than 109.4 is generally fatal. That needs to be highlighted. A body temperature less than 97 degrees is classified as subnormal or hypothermia. That needs to be highlighted. This means that the heat the body is losing is greater than the heat it is producing. A person usually cannot survive with a temperature below 93.2 degrees. That needs to be highlighted. All right, so let's go on over at the bottom of page 89. It's going to talk about variations in body temperature. During the day-to-day activities, an individual normal body temperature may fluctuate. The body temperature rarely stays the same throughout the course of the day. The medical assistant should take the following points into consideration when evaluating a patient's temperature. 1. Age. Infants and young children normally have a higher body temperature than adults because their thermoregulatory system is not yet fully established. And if you look in table 4.2, it gives you the variations in body temperature by age. That is good for you guys to know. Number 2, diurnal variations. During sleep, body metabolism slows down, and so do muscle contractions. The body temperature is lower in the morning before metabolism and muscle contractions begin increasing. Number 3, emotional states. Strong emotions such as extreme anger and crying can increase the body temperature. This is important to consider when working with young children who frequently cry during examination procedures or when they are ill. Number 4, environment. Cold weather tends to decrease the body temperature, whereas hot weather increases it. Exercise. Vigorous physical exercise causes an increase in voluntary muscle contractions, which elevates the body temperature. Number 6, patient's normal body temperature. Some patients normally run a low or a high temperature. The medical assistant should review the patient's past vital sign documentation. Number 7, pregnancy. Cell metabolism increases during pregnancy, and this elevates body temperature. Now we're going to go on down to fever. Fever or pyrexia denotes that a patient's temperature has increased to higher than 100.4 degrees. An individual who has a fever is said to be febrile. That needs to be highlighted. One who does not have a fever is afebrile. Fever is a common symptom of illness, particularly inflammation and infection. Now we're going to go on down to stages of fever. Number 1, the onset is when the temperature first begins to increase. That needs to be highlighted. Number 2, during the course of a fever, the temperature rises and falls in one of the following 3 fever patterns: continuous, intermittent, and remittent. Fever patterns are described and illustrated in Table 4.3. During this stage, the patient has an increased pulse and respiratory rate and feels warm to the touch. The patient may also experience one or more of the following: flushed appearance, increased thirst, loss of appetite, headache, and malaise. Malaise refers to the vague sense of body discomfort, weakness, and fatigue. All of that we just went over, from starting of during the stage the patient has an increased pulse all the way down to fatigue, needs to be highlighted. Number 3, during this subsiding stage, the temperature returns to normal. It can return to normal gradually or suddenly, known as a crisis. As the body temperature is returning to normal, the patient usually perspires and may become dehydrated. That needs to be highlighted. Now we're going to go on to page 91. I want you guys to highlight in table 4.3 where it discussed the pattern continuous, intermittent, and remittent fever, and I want you to highlight the descriptions. And if we go on down to where it says assessment of body temperature, assessment sites, there are 5 sites for measuring body temperature: mouth, axilla, rectum, ear, and forehead. That needs to be highlighted. Oral temperature. The oral method is a convenient and one of the most common means for measuring body temperature. When the medical assistant documents a temperature, the provider assumes it has been taken through oral route unless otherwise noted. There is a rich blood supply under the tongue in the area on either side of the frenulum linguae. The thermometer should be placed in the area to obtain the most accurate reading. The patient must keep the mouth closed during the procedure to provide a closed space for the thermometer. Axillary temperature. The axilla is recommended as a site for measuring temperature in toddlers and preschoolers. That needs to be highlighted. The axilla site also should be used for mouth breathing patients and for patients with oral inflammation or who have had oral surgery. The temperature obtained through the axillary method measures approximately 1 degree Fahrenheit lower than the same person's temperature taken through the oral route. That needs to be highlighted. Then we're going to skip on over to rectal temperature. The rectal temperature provides an extremely accurate measurement of body temperature because few factors can alter the results. That needs to be highlighted. The rectum is highly vascular and, of the 5 sites, provides the most closed cavity. The temperature obtained by the rectal route measures approximately 1 degree Fahrenheit higher than the same person's temperature taken by the oral route. The medical assistant should make a notation on the patient's chart if the temperature has been taken rectally. That needs to be highlighted. In general, the rectal method is used for infants and young children. That needs to be highlighted. The rectal site should not be used with newborns because of danger of the rectal trauma. That needs to be highlighted. Oral temperature. The oral ear site is used with the tympanic membrane thermometer. The ear provides a closed cavity that is easily accessible. Tympanic membrane thermometers provide an instantaneous results. They are easy to use and are comfortable for the patient. They make it easier to measure temperature of children younger than 6 years, uncooperative patients, and patients who are unable to have their temperatures taken orally. All of that needs to be highlighted. Forehead temperature. The temporary artery is a major artery of the head that runs laterally across the forehead and down the side of the neck. That needs to be highlighted. And the area of the forehead is located approximately 2 millimeters below the surface of the skin. Because the temporary artery is located so close to the skin's surface and is easily accessible. That needs to be highlighted. The forehead provides the ideal site for obtaining a body temperature measurement. Next paragraph. The forehead site can be used to measure body temperature using a temporal artery thermometer in individuals of all ages. That needs to be highlighted. The results compare in accuracy with other methods used to measure body temperature. The temperature obtained from the forehead site is about the same as a rectal temperature measurement. That needs to be highlighted. The temporal artery readings measure approximately 1 degree higher than oral body temperature and 2 degrees higher than axillary temperature. That needs to be highlighted. Types of thermometers. The 4 types of thermometers available for measuring body temperature are electronic thermometers, tympanic membrane thermometers, temporal artery thermometers, and chemical thermometers. All of that needs to be highlighted. Now we're going to go on down to the electronic thermometer. In the second paragraph down at the end, I want you guys to highlight the oral probe is color-coded with blue on its collar and is used to take oral and axillary temperatures. The rectal probe is color-coded with red on its collar and is used to take rectal temperatures only. That needs to be highlighted. A disposable plastic cover is placed over the probe to prevent the transmission of microorganisms among patients. That needs to be highlighted. If we go on over to page 93, you'll notice in figure 4.4 where you can see the blue is for the oral and the red's for the rectal. If we go on down to the tympanic membrane thermometer, if you will go to the second paragraph and highlight where it says the tympanic membrane thermometer is battery operated and consists of a small handheld device with a sensor probe. That needs to be highlighted. To operate the thermometer, the probe is covered with a disposable soft plastic cover. That needs to be highlighted and is placed in the outer third of the external ear canal. All right, and then if you on page 4.6, that's a picture of what you would use for the ear. A tympanic membrane thermometer. All right, now let's go on down to temporal artery thermometer. Use of a temporal artery thermometer is the newest method for accessing body temperature. That needs to be highlighted. Okay, let's go on over to page 94. I want you guys to read box 4.1. And I want you to highlight under number 6 where it says fingerprints, cerumen, and dust reduce the transparency of the lens, resulting in falsely low temperature readings. That needs to be highlighted. If you go on down to 8, you need to highlight where it says to clean the lens, gently wipe its surface with an antiseptic wipe and immediately wipe it dry with a cotton swab. And then I want you to highlight where it says thermometer casing. Clean the casing of the thermometer periodically by wiping it dry with a soft cloth slightly moistened with alcohol. And then if we go on over to page 95, I want you guys to highlight where it says in the very first paragraph, kind of down to the bottom, the probe sensor captures the highest temperature or peak temperature. That needs to be highlighted. Along with measuring the peak temperature, the probe sensor automatically measures the ambient temperature. That needs to be highlighted. Now, if we go on down to where it says earlobe temperature measurement, sweating of the forehead can cause an inaccurate temporal artery temperature reading. That needs to be highlighted. If you go on down to the very last sentence, I want you to highlight where it says to avoid this problem, the temperature of the neck area located just behind the earlobe also must be measured. If you guys can also be familiar with box 4.2, and then I want you to highlight where it says scanning the forehead too quickly. That will need to be highlighted. Okay, under care and maintenance, we're going to go to the second paragraph. I want you to highlight where it says preventing the probe sensor from getting an accurate view of the heat emitted by the temporary artery and resulting in a falsely low reading. The lens should be cleaned if it becomes dirty and as part of a routine maintenance. The lens is cleaned by gently wiping its surface with an antiseptic wipe. All that needs to be highlighted. We're going to go on down to chemical thermometers. Chemical thermometers contain chemicals that are heat sensitive and include disposable chemical single-use thermometers and temperature sensitive strips. They are used most often by patients at home to measure body temperature. Although chemical thermometers are less accurate than other types of thermometers, they assist in providing a general assessment of the body temperature. Because of the chemical makeup, they should be stored in a cool area, preferably colder than 86 degrees. That needs to be highlighted. And then if you look on page 96, that is what a chemical thermometer looks like. And then you guys do need to continue becoming familiar with things like the procedure 4.1. And then I want to go all the way to page 101 and under number 5 where it says procedural step. I want you to highlight where it says a lubricant thermometer can be inserted more easily and does not irritate the delicate rectal mucosa. That needs to be highlighted. And then number 6, I want you to highlight the part where it says approximately 1 inch into the rectum of the adult, 5/8 of an inch in children, and a 1/2 inch in infants. That needs to be highlighted. Okay, and then I want to go on over to page 107. You need to become familiar where it says the mechanism of the pulse. When the left ventricle of the heart contracts, blood is forced from the heart into the aorta, which is the major trunk of the arterial system of the body. The aorta is already filled with blood and must expand to accept the blood being pushed out of the left ventricle. This creates a pulsating wave that travels from the aorta through the walls of the arterial system. This wave, known as the pulse, can be felt as a light tap by an examiner. The pulse rate is measured by counting the number of taps or beats per minute. The heart rate can be determined by taking the pulse rate. Factors affecting the pulse rate. I want you guys to make sure you're highlighting number 1, 2, 3, 4, 5, 6, and 7. You will need to know that. Let's go on down to pulse sites on page 107. The pulse is felt most strongly when a superficial artery is held against a firm tissue, such as a bone. That needs to be highlighted. And if you guys look on page 107, there on figure 410, there are the pulse sites. You guys should also already have a copy of this and are already becoming familiar. I want you guys to highlight under radial. The most common site for measuring the pulse is the radial artery, which is located in a groove on the inner aspect of the wrist just below the thumb. That needs to be highlighted. And then I want you guys to highlight on the apical. Down at the bottom, the chest piece of the stethoscope is placed lightly over the apex of the heart, which is located in the 5th intercostal between the ribs space at the junction of the left mid-clavicle line. That needs to be highlighted. For the brachial, you need to highlight where it says the brachial pulse is in the antecubical space, which is the space located at the front of the elbow. Ulnar. The ulnar pulse is located on the ulnar little finger side of the wrist. That needs to be highlighted. You need to also highlight where it's under the femoral. The femoral pulse is in the middle of the groin. And then I want you to highlight under the posterior tibial. The posterior tibial pulse is located on the inner aspect of the ankle, just posterior to the ankle bone. This site is used to assess the status of circulation to the foot. That part needs to be highlighted. For the dorsalis pedis, You need to highlight where it says the dorsalis pedis pulse is located on the upper surface of the foot between the first and second metatarsal bones. Now we're going to go on over to page 109. You need to make sure that you're highlighting under the assessment of the pulse. The purpose of measuring pulse is to establish the patient's baseline pulse rate and to assess the pulse rate after special procedures, medications, or disease processes that affect heart functioning. All that needs to be highlighted. We're going to go on down to pulse rate. The pulse rate is the number of heart pulsations or heartbeats that occur in 1 minute. That needs to be highlighted. I want you to also highlight where it says normal resting pulse rates ranges from 60 to 100. And if we go on down to the next paragraph, you need to highlight an abnormally fast heart rate of more than 100 beats per minute is known as tachycardia. That is important, and you need to highlight that. You also need to know and highlight where it says bradycardia is an abnormally slow heart rate, less than 60 beats per minute. If we go on down to where it says pulse rhythm and volume, in addition to measuring the pulse rate, the medical assistant should determine the rhythm and volume of the pulse. The pulse rhythm denotes the time interval between heartbeats. A normal rhythm has the same time interval between beats. Any irregularity in the heart's rhythm is known as a dysrhythmia, also termed arrhythmia, and is characterized by unequal or irregular intervals between the heartbeats. If a dysrhythmia is present, the provider may order one of the following: an apical radial pulse, an electrocardiogram, or a Holter monitoring. An apical radial pulse is measured to determine whether a pulse deficient is present. That needs to be highlighted. If we go on over to the other side on page 109 at the very top, please highlight a pulse deficient exists when the radial pulse rate is less than the apical pulse rate. If you go down to where it says the pulse volume refers to the strength of the heartbeat, that needs to be highlighted. The amount of blood pumped into the aorta by each contraction of the left ventricle should remain constant, making the pulse feel strong and full. If the blood volume decreases, the pulse feels weak. That needs to be highlighted and may be difficult to detect. The type of pulse is usually accompanied by a fast heart rate and is described as a thready pulse. That needs to be highlighted. An increase in the blood volume results in a pulse that feels extremely strong and full, known as a bounding pulse. That needs to be highlighted. Now we're going to go on over to where it says mechanisms of respiration. I want you guys to highlight on the second paragraph where the very first sentence, each respiration is divided into 2 phases, inhalation and exhalation. And then I want you to go on down to and highlight where it says exhalation or expiration involves the removal of carbon dioxide from the body. That needs to be highlighted. I want you to highlight the very last sentence of the third paragraph right before control of respiration. The exchange of oxygen and carbon dioxide between the body cells and the blood is known as an internal respiration. That needs to be highlighted. Control of respiration. The medulla oblongata, located in the brain, is the control center for involuntary respiration. That needs to be highlighted. Now I want to go on over to page 111 where it says respiration rate. Respiration rate of a normal healthy adult ranges from 12 to 20 respirations per minute. With most adults, there is a ratio of 1 respiration for every 4 pulse beats. That needs to be highlighted. An abnormal increase in the respiratory rate of more than 20 respirations per minute is referred to tachypnea. An abnormal decrease in the respiratory rate of less than 12 respirations per minute is known as bradypnea. Those 2 things need to be highlighted. And then I do want you guys to highlight the next 5 things and make sure that you do read them. When measuring the respiratory rate, the medical assistant should take in consideration the following factors. Number 1, age. Highlight as age increases, the respiratory rate decreases. Number 2, physical activity. Number 3, emotional states. Number 4, fever. And number 5, medication. Those things need to be highlighted. But I do want you to become familiar with the image on table 4.5. Okay, now we're on page 112. Under rhythm and depth of respiration, in the very last part of the first paragraph, you need to highlight where it says normal respiration is referred to as eupnea. The rate is approximately 12 to 20 breaths per minute. The rhythm is even and regular, and the depth is normal. The next paragraph, the very first sentence, needs to be highlighted. Hyperpnea is an abnormal increase in the rate and depth of respirations. If you go on over to where it says hyperventilation is an abnormal fast and deep type of breathing that is usually associated with an acute anxiety condition, such as panic attacks. That needs to be highlighted. That's very important for you to remember. Hypopnea is a condition in which the patient's respiration exhibits an abnormal decrease in rate and depth. The depth is approximately half that of normal respiration. Hypopnea often occurs in individuals with sleep disorders. You will need to know the meaning of cyanosis, which causes a bluish discoloration of the skin. Apnea is a temporary absence of respirations. You will need to highlight and know both of those. Under respiratory abnormalities, a patient who is having difficulty breathing or shortness of breath has a condition known as dyspnea. Dyspnea may occur normally during vigorous physical exertion and abnormally in patients with asthma or emphysema. A patient with dyspnea may find it easier to breathe while in sitting or standing position. This state is called orthopnea and occurs with disorders of the heart and lungs, such as asthma, emphysema, pneumonia, and congestive heart failure. If you go on down to where it says pulse oximetry, you need to highlight where it says pulse oximetry is a painless and non-invasive procedure used to measure the oxygen saturation of hemoglobin in arterial blood. Hemoglobin is a complex compound found in red blood cells that functions in transporting oxygen in the body. That needs to be highlighted. I also want you to highlight where it says a pulse oximeter is the device used to measure and display the oxygen saturation of the blood. And if you look on figure 414, that is what a pulse oximeter looks like. I can't talk today. Okay, on to page 114. I need you guys to highlight down almost at the very bottom of the very first paragraph where it says, because the pulse oximeter measures the oxygen saturation of peripheral capillaries, the abbreviation is S_p, big O, and 2. That needs to be highlighted. Interpretation of results. You need to highlight where it says the oxygen saturation level of most healthy individuals is 95 to 99%. Now we're going to go on over to the other side, and you need to make sure you highlight where it says a decrease in the oxygen saturation of the blood less than 95% is known as hypoxemia. Now we're going to go on down to where it says the purpose of pulse oximetry. You need to highlight where it says conditions that can cause a decreased oxygen levels value hypoxemia include the following: acute pulmonary disease, such as, for example, pneumonia; chronic pulmonary disease, for example, emphysema, asthma, and bronchitis; and then again in cardiac problems. For example, those are going to be congestive heart failure or coronary artery disease. you need to make sure you highlight and become aware of that. If we go on over to page 115 under number 8, I want you to highlight when the pulse oximeter is turned on, it automatically performs a power on self-test, POST, which takes approximately 3 to 5 seconds. During the POST, the oximeter checks its internal systems to ensure they are functioning properly. That needs to be highlighted. Now I want to go on over to page 116, and I want you guys to make sure that you're familiar with the factors affecting pulse oximetry. Number 1, number 2, and number 3. Please make sure you read all that, as well as number 4 and number 5. If we go to where it says pulse oximeter care and maintenance, you need to highlight the very first sentence. The pulse oximeter monitor and cable should be cleaned periodically using a cloth slightly damped with a solution of warm water and a disinfectant cleaner. Now I want to go on over to page 122, and you need to make sure that you highlight everything on the mechanism of blood pressure. Blood pressure is a measurement of the pressure or force exerted by the blood on the walls of the arteries. That needs to be highlighted. You need to highlight where it says this phase in the cardiac cycle is known as systole, and it represents the highest point of blood pressure in the body, or the systolic measure. The phase of the cardiac cycle in which the heart relaxes between contractions is referred to as diastole. The diastolic pressure recording during diastole is lower because the heart is relaxed. You need to be familiar with both of that. Please be familiar with table 4.7. And then I also want you to highlight where it says under the interpretations of blood pressure, the standard unit for measuring blood pressure is millimeters of mercury. That needs to be highlighted. A blood pressure reading of less than 120/80 is classified as normal. And again, you'll see where it says millimeters of mercury. That needs to be highlighted. If we go on over to page 123, I want you to become familiar with table 4.8. And then I want you to highlight in the, it'd be considered the second paragraph on page 123, where it says the most common condition that causes an abnormal blood pressure reading is hypertension. Hypertension or high blood pressure results from excessive pressure on the walls of the arteries. That needs to be highlighted. Hypotension or low blood pressure results from reduced pressure of the arterial walls. That needs to be highlighted. And we're going to go down to where it says pulse pressure. The difference between systolic and diastolic pressure is the pulse pressure. You will need to know that. Factors affecting blood pressure. You need to make sure you are familiar with 1, which is age, 2, gender, 3, diurnal variations, 4, emotional states, 5, exercise, 6, body position, 7, medication, and number 8, other factors. I do also want you to highlight where it says other factors that may increase the blood pressure include pain, a recent meal, caffeine, smoking, and bladder distension. And then I want you to highlight under the assessment of blood pressure manual method. The equipment needed to measure blood pressure using the manual method includes a stethoscope and a sphygmomanometer. The method requires the medical assistant to perform the steps in the procedure manually or by hand. This includes inflation and deflation of the cuff, determining the blood pressure measurement by listening to the sounds produced by the brachial artery. The equipment required for the manual measurement of the blood pressure is described in more detail in the following sections. I do want you guys to read over 124, 125. And if we go on over to page 126, the very first paragraph, I want you to highlight where it says for accurate blood pressure measurement, the inner bladder of the cuff should encircle at least 80%, but not more than 100%. of the arm circumference and should be wide enough to cover 2/3 of the distance from the axilla to the antecubital space. That needs to be highlighted. If you go on over to the other side under table 4.9, the second sentence needs to be highlighted where it says the thigh cuff is used for taking blood pressure from the thigh or for adults with large arms. That needs to be highlighted. Okay, now I want you guys to highlight on page 131 where it says phase 1, and then again where it says phase 5, which is going to be the very last one. Those two things need to be highlighted. And then we're going to go on over to page 132. I want you to highlight number 1 and number 2 under advantages, and under number 1 disadvantages. And as you guys can see, you guys should be very aware and are already doing procedure 4.9 and are familiar with the vital signs. And then that's all on that one that I need you to highlight and become familiar with. But again, students, please do not forget, you need to read the entire chapters. I am only here discussing the bullet points that are going to be used in reference to whether it's homework or on exams. But it is your responsibility to cover each of these chapters and read them in full daily.